Patient Portal is the medium for web-based interaction between patients and their providers. Patients will use the Patient Portal to update their demographic information, request medication refills, and send questions or messages to their provider. By using the portal, we anticipate that clinical and phone volume will be decreased and time will be saved, all while empowering patients to take greater control over the management of their own health. In addition, having a patient portal supports 2 core measures for meaningful use stage 2. Core measure 7. 50% of all unique patients seen by the EP in the reporting period are provided timely online access to their health information within 4 business days. More than 5% must be able to view, download, or transmit their health information to a third party. And core measure 17, more than 5% of all unique patients seen by the EP must be able to send a secure message to the provider. MMA has created a policy identifying who can access the patient portal. Parents and legal guardians of children 0 to 12 years of age and qualified adults 18 years and older. In addition, the policy also identifies those patients that may not have portal access. Children between the ages of 13 and 17, portal access will have to be revoked for patients once they turn 13. Patients who have terminated their treatment relationship, patients who are incarcerated, patients who are not in compliance with the portal terms of use agreement. For a patient to gain access to the portal, they will need to register for their access. It will be the responsibility of the office staff to ask the patient if they are interested in joining the portal. If interested, the staff will access Cerner's provider tool, where they will search for the patient and extend an invitation by sending it to the patient's preferred email address. If a patient indicates that they are not interested, then we will record that response in either the patient's intake form or through an ad hoc form. Invitations to the portal are sent to the patient via email. The patient will click the link in the email to begin the registration for the portal. The EMR will automatically update to reflect if a patient has been sent an invitation to the portal. Note, currently you can only see if the patient has asked to be sent an invitation to the portal. Functionality is coming from Cerner in the next few weeks that will also indicate if the patient has accepted their invitation and accessed their portal page. Once the patient clicks the link in their email, they are taken to the IQ Health page. IQ Health is the name of Cerner's patient portal. The Welcome to IQ Health page is where they will begin their registration. A confirmation question displays asking you if you are the patient. Clicking this drop-down displays options. This is how parental proxy is set up. After the patient has set up their account and created their username and password, they will be granted access to their information. Clicking the health record link will display their details. The health record page displays portions of the patient's medical information. What can patients see and do on the portal is a frequently asked question. When viewing their health record, a patient can see current medications, current immunizations, allergies, and health issues such as problems. Lab results. Patients will have access to their labs processed by Mission 96 hours after the results have been returned via the hub. Procedure histories, and visit summary documents from previous visits, including those visits that occurred before the patient portal went live. Currently, the MMA policy states that Mission practices will not initiate messages to patients via the portal. However, patients will have the ability to send messages to their provider, and the provider may respond via the portal. The messaging process. All patient-initiated messages from the portal are automatically routed to the office message pool. Office staff will review messages and forward them to the appropriate person for review. You may respond to patient messages. Responses will go to the patient's portal, and the patient will receive an email telling them they have a message waiting for them. This concludes the patient portal overview. Additional training will be made available for working with the provider tool, managing messaging pools, and responding to patient messages.